welcome back to the Providence Holy Cross Health Hour here on KHTS AM 1220, your hometown station. I'm Tom Burton from Providence Holy Cross, the Orthopedic Program Manager. And I am just so pleased that we have the opportunity. We have two guests in, which is not the norm for us on our show. And a lot of it was stimulated by the upcoming fair that we're going to have, an expo over at College of the Canyons, the Cancer Awareness and Resource Expo, coming up on February 25th from 8 a.m. to 3:30 p.m. Over at the Santa Clarita Performing Arts Center. And really, really encourage everybody, go online to carescv.com, carescv.com, to not only get some of the more of the details, but also to go ahead and register. And with the honor of being able to present this, so that way we can have Santa Clarita come to see all of the medical experts and all of the medical groups and the medical corporations that are going to be helping in their care. It gives us the opportunity to meet two extremely wonderful people. And you just heard before the commercial, Vivian Gonzalez, our oncology nurse navigator, over at Holy Cross, and she was just talking about the lung cancer screening program, and we've got a couple of phone numbers, right?
We do, and if you want to learn more or find out more, if you qualify for the lung cancer screening program, you can call 1-877-LUNG-INFO. Again, that's 1-877-LUNG-INFO.
Great. And then the test, the lung screening itself, that occurs not only at Holy Cross, but...
We have 3 locations for screening, one in Porter Ranch, one in Santa Clarita, and one in Mission Hills.
And where in Santa Clarita? I'm sure the Santa Clarita residents will be really happy to hear that.
It is off of McBean Parkway.
Very good. Very, very good. And we'll come back to that as well as when we wrap. I do want to make sure that everyone knows that our 1-888-HEALING number is also a very good number to call, HEALING, which will allow you the opportunity to talk with somebody who can actually get you to any of the resources that we have at Holy Cross and put you in correct contact. Now, we're going to go in a lot deeper. We're taking it down. In fact, if you were listening to the previous show at 11, they were talking about genetics, and it's about as deep of a dive as we're going to go physiologically, I would bet. And the important portion of genetics, as we're finding with cancer treatment, cancer care, and being able to predict, prevent, and the such. And so I get an opportunity. This is such a great job because I get a chance to meet everybody. And though we all work at the same hospital, oftentimes outside of sitting next to one, we don't get a chance to meet everybody. So we have Monica Helm, who is the genetics counselor with Providence's Southern California region. Now, it's not just the hospital, but you actually oversee the entire region for Southern California, which is a really big deal, partly because she's from Northern California, and so she at least came to the right side of the state, and also enjoyed the UC Regents, being an undergrad from UC Davis, receiving her master's in genetics and genetics counseling from, again, another UC school, San Francisco, in a conjunction with Cal State Stanislaus, right? And you're also new with Providence, coming on board in July of last year, 2016, and I think one of the things before we move into this to just know is that Providence is recognizing well in advance. They're 5 or 10 years out in thinking on how their programs are going to be developed. And you can kind of get an impression that they're bringing on a large number of program managers, experts within their fields, for things that are going to assist our communities in the future, not just at the present time, but also in the future. And that's one of the things that Providence is doing. And, my gosh, if you have the ability to really predict into the future, we can actually take a look at our actual structure, our makeup, if you will, and genetics. And I'm just going to turn it over to you because I'm going to be swimming out of water here. So go for it, Monica.
Thank you so much for having me. Yeah, I think the topic of genetics is definitely a broad one. So given that we are really focused on, talking about the expo today and how it relates to the services within the cancer care spectrum that Providence is able to give, I'll certainly focus a lot of my topics on how genetics can help with cancer screening and, yes, prevention as well. So as a background, the Providence Center for Clinical Genetics and Genomics was formed actually a couple of years ago under medical geneticist Dr. Aura Gordon, who's been in the area for a long time. She's a Southern California person after coming from the East Coast, and genetic counselor Kim Childers. So the three of us make up the genetics program now, which, like Tom mentioned, is throughout Southern California. And I will be seeing patients I am now currently seeing patients in Mission Hills through Holy Cross. And, really what we wanted to talk about today is making sure that you all know that there are services for you in the area that you're being cared for, and you don't have to be traveling too far to see someone if you have questions about your personal or family history of cancer. And we can certainly go into more detail about that too.
I think that's great. And, it was such an important point that Dr. Klein had made a bunch of months back was with our community partnership with City of Hope. We were bringing experts on cancer care to Holy Cross and to the San Fernando and Santa Clarita Valley, so that way patients can be close to home and close to their families throughout the continuum of care that they have to be able to go through, and to have, and that would include going to a geneticist. That's something that you normally would have to travel abroad almost and take time away from your family, take time away from work, and this can actually be like going in for an office visit now. So that being said, tell me about the office visit.
Yeah, so just to hint, I know Los Angeles, I'm a little new to Southern California, as you mentioned, although Northern California gets its, bad traffic as well. And I came from Houston. I was working at MD Anderson previously, where there's also a lot of traffic. So I appreciate that people don't want to have to get in their cars for several hours in bumper-to-bumper traffic to get the care that they need. So I think it's great that we're able to, bring our services throughout Southern California. Just to reiterate, we're up in Mission Hills. That's what we're focusing on today, but we have clinics in Burbank and Santa Monica at St. John's, and down in Torrance at Little Company of Mary. So wherever you are, we are trying to be as well. If you make it into the office, the office visit really is more talking than I think most visits tend to be. So pretty painless if you find talking to be painless. And it's really just an assessment of your personal history, including possible history of cancer. And even if you yourself don't have a history of cancer, your family history of cancer can be a big indicator as to whether or not one of these genetic or hereditary causes for an increased risk of cancer is something we want to assess you for. So it's estimated to be between 10 and 15% of all cancer diagnoses have an underlying inherited component, meaning that those individuals throughout their lifetime have been at an increased risk to develop certain types of cancers. And we now have the ability to test individuals' saliva or blood to look for those factors and see whether there is an increased risk for cancer. And our hope is to catch that before someone develops the cancer, such that we're then implementing increased screening protocols or even different screening protocols from the standard. A good example is in breast cancer. We know that all women starting at 40 are recommended by multiple institutions to start yearly mammograms. And we know mammograms are very good at picking up breast cancers, although not perfect. And women who are able to find have a genetic or inherited predisposition to breast cancer who might be at an increased risk beyond what the average woman is at. In addition to having annual mammograms, we might recommend they have MRIs of their breast as well throughout that year, so that we're getting multiple images of that woman's breast at multiple touch points, not going 12 whole months between screenings, but only going 6 months between screenings. So, and again, cancer affects multiple areas of the body, and so, I want us to walk away not thinking breast is the only site, but I think that's a good example.
Right, and then, just because it seems to be, if it makes it into the media, it seems to be more real, as you're listening to us on Facebook Live as well. Welcome to all the people who are watching. The Angelique Jolie would be a great example of this, right? Now, she I don't remember the entire story. Maybe you can go into it just briefly. What did she have to go through?
Yeah, so Angelina Jolie had genetic testing because she had a family history of cancer. Her mother had cancer very young. She had testing for what's called the BRCA1 gene, or BRCA1, some people call it. It's one of the more common and high-risk breast cancer risk genes. And she tested positive, which not only enlightened her care providers that she was at, rather than a 10 to 12% lifetime risk for breast cancer, which the average woman is at, she was, at up to maybe an 80 to 85% lifetime risk for breast cancer, which warranted the consideration of the surgeries that she decided to undergo. She removed both of her breasts preventatively to decrease as much as possible, although we can never eliminate the risk for breast cancer. Certainly that's a choice women can make if they test positive for certain genes that increase their risk for breast cancer, but that increased screening is another option. The other thing that Angelina Jolie talked about in her, I think it was an article in the Times, is the removal of her ovaries. These genes that we're able to test for don't just look for predispositions to one certain type of cancer. They oftentimes can tell us that individuals are at risk for a collection of cancers. So in addition to breast cancer, she was found to be at an increased risk for ovarian cancer, which, she decided to remove her ovaries to reduce that risk as well.
Right. Okay, so a perfect example and something that we will have seen, so it's not too unfamiliar to us, but it really seems to bring it home, is why, gaining more information, maybe going off to an expo to learn more, hear from the experts, come in. If you do have a familial history of cancer, but also rare type of cancers too, even if you yourself had it, it's worth going in genetics, right?
Yep. And I think, every day that goes on, we have a greater recognition of how many cancers have these underlying genetic components to them, and how we can look at people who, we think of it in almost a couple of different arms. Individuals who have a personal history or are currently diagnosed with cancer, we want to see those individuals, if they have a rare type of cancer, if they have a cancer that other members of their family have had, if they have a cancer diagnosed under the age of 50, some of those are red flags, not only to help them in their current treatment, because it can absolutely open up different treatment options, but also to think about reducing their risk for future cancers. And this touches the family. So we know we inherit our genetic information from our parents, and we pass our genetic information on to our children. So it doesn't just help the individual who we're working with, but their family members, which gets to the two other arms we always think of, which are individuals who themselves don't have a history of cancer, but know they have a family history of cancer. We want to see those people. And a lot of people actually, now that genetic testing is becoming a little bit more common and widely used, have family members who have had testing, have already been found to have one of these genetic risk factors for cancer, and they can come to us to have testing for that as well.
Gotcha. And then depending on how all this testing comes through, I noticed that there is high risk management that's available, as well as prevention programs, and that's where Dr. Gordon, well, yourself as well, but Dr. Gordon would also become involved. And what would someone might expect?
Yeah, that's a really great, I think, component of the Providence program is, individuals can come in and see a medical geneticist and a genetic counselor to assess their personal and family history, we spent a lot of time discussing, and choose to have genetic testing. And then once those results come back, the genetic counselor, in conjunction with Dr. Gordon, the medical geneticist, interprets those results and doesn't just take those results by themselves. So what is your genetics telling us about your risk? But we also look back at those personal and family history pieces of information we got when we initially talked to the individual to come up with an overall screening plan. So sometimes people go through this testing process and may test negative, meaning that we didn't find anything in their genes, but we're still seeing something in the family that's telling us they might be at an increased risk for cancer. We still want to put those people on a different screening protocol than the average individual because we suspect their risk is slightly higher. same is if we get the results back in those individuals, someone does test positive, meaning they do have some sort of genetic or inherited risk factor for cancer. That's where Dr. Gordon really comes in and follows patients semi-annually, annually, over many, many, many years. She's been doing that for a long time now. So not only do we give the best recommendations from the second that we find this out, but we're able to keep on top of, as we learn more and more about inherited risk factors for cancer, making sure our patients are cared for in the best way possible.
And then does behavior modification kick into any of this?
Yeah, so Dr. Gordon
Already know
also,
the answer.
Dr. Gordon, in addition to being a medical geneticist, she's kind of a, what is it called, a jack of all trades. She also has a fellowship in integrative medicine, so she's able to incorporate some other techniques to help reduce cancer risk, and that's a really great part of the high risk program that she runs as well.
Oh, that's fantastic. And then the program itself, it's the consultation itself, I would assume, is something that's going to be covered by insurances?
Yeah, so one of the big questions we always get is related to insurance. Is the consultation covered? Is the testing covered? If I test positive for something, will my health insurance no longer cover me? So I want to address all of those because I think sometimes that's a barrier for people to kind of come in. So the first thing is most insurance companies cover genetic consultation. And actually, as part of our program, we have individuals making sure before people come in to see us that their insurance does cover the consultation, but the vast majority of insurances do. The testing itself is also oftentimes covered. An advantage of coming to see us is that we're able to assess your personal and family history and write a note detailing to the insurance why it's important for these things to be covered. So that's oftentimes the case. And if we assess and we don't think it meets criteria that the insurance might use, there are also options to pay out of pocket for, $100, $200, $50 or so. So it can be accessible and people can go on payment plans as well so that all that payment doesn't need to happen at once, although many, many times it's covered and people don't pay a dime for the genetic testing. And then the last question, which I think can oftentimes be the scariest for people, is wondering whether or not if they pursue this testing and something is found that they won't be able to be covered by insurance any longer. We have a federal act called GINA, the Genetic Information Non-Discrimination Act. It was put into place, I think, back in 2008, that protects individuals from health insurance and employment discrimination on the basis of these results. So health insurance and employers can't even ask for the results, and it's illegal for them to utilize it in any way.
Perfect. And then, so it's something that can be covered, all right. Oftentimes, depending on the insurance, I would assume that there probably has to be a referral. So there has to be some sort of an issue that maybe their internist will look at it and say, is this something that would be beneficial to you, knowing your family histories? And theoretically, it's an investment to that HMO too, to try to head things off, if you will. The peace of mind. Does that ever come up? I'm going to ask both, you and Vivian. Peace of mind is a big deal, and that's one of the things that you're delivering, right?
Yeah, I think, so just to comment really quickly on the insurance question, certainly if you have an insurance that requires referrals for all specialty care, then yes, it requires referrals, but we also accept self-referrals. So if you have a PPO insurance or another type of insurance that allows you to refer yourself, we're happy to see you. You can just call us. From the standpoint of peace of mind, yeah, I think, and Vivian, jump in as well. I think we're able to offer that to some extent, maybe not always because we are able to give a clear-cut answer, but I oftentimes find that there's a lot of misconceptions about cancer risk and how high cancer risk is. And I think through coming for a genetics consultation, you can have an expert really sit down and look at your personal and family history, as well as if you pursue genetic testing, and put all of that together to give you a really clear-cut risk assessment rather than just being told you're at this risk or that risk and not really knowing what that means or what to do about it.
Right. And then for the, let's say, for the lung screening as well. Now that some insurance, Medicare specifically, can you go through that, Vivian?
Correct. So a lot of private payers and Medicare have now agreed to pay for this low-dose CT scan if you meet criteria. So again, as the oncology navigator, I am in charge of walking you through that process. So deciding to have the lung cancer screening exam is an important first step to better lung health. But I do find that when I am discussing the lung cancer screening patient CT scan with patients, when they hear one of the benefits is finding lung cancers, again, that makes them take a step back and, well, what if I don't want to find out if I have early stage lung cancer? But again, it's finding it at an early stage and to be able to remove these promptly that makes them want to go ahead with the screening. So there is that little fear, the risk for false positive examinations or risks of additional CT scannings or biopsies. However, when we discuss the risks and the benefits outweigh the risks, and the decrease in mortality for smokers is tremendous.
And I can only imagine that. So we go through the genetic testing, we go through the lung scans. Let's say the lung CT comes back as negative. Maybe the genetics testing shows that maybe there's a low risk. That's all that is at that time is a number, and that gives you an opportunity that we can start making decisions and better decisions for our health. A cessation program, let's just say.
Absolutely.
That, hey, we didn't come up as positive now, doesn't mean later on we won't, but if we were to stop smoking, we can decrease the risks. If we make changes, lifestyle changes for certain types of cancers, I would assume that will help kind of swing the pendulum in our favor. Is that right?
I agree. I think that just speaking to a lot of patients already, there is that want to stop smoking for a lot of patients for the various reasons. They don't like the smell. It became a habit. They started at a young age, and for the risk of the various cancers. So it just being able to talk to them from the beginning, I believe, is beneficial.
Perfect, and same with the genetic testing too. Is that it's a number, it's an odds. We can improve our odds, we can worsen our odds depending on the decisions we make.
Yeah, I think that the genetic testing component can certainly tell us whether there's some sort of underlying genetic issue that will cause an individual to be at a significantly higher risk for cancer than we would anticipate. So those people we want to very quickly get out of the kind of standard screening protocol and put them into a special screening protocol. But oftentimes individuals test negative, and even when that happens, not only does that give us some reassurance that those genetic issues don't exist, but also we've now taken the time to assess the family history and still decide whether that individual may be at a higher risk, and we still want to offer them more screening. And like you alluded to, there are certain cancers that respond really well to some risk reduction protocols, like, in some instances with the family history of colon cancer, taking a baby aspirin every day can be very beneficial, or, birth control pills, or contraceptive pills, reducing the risk for ovarian cancer. And that's something where the genetic counselors work with Dr. Gordon to make sure that any sort of risk reduction options possible are available.
That's great. And, you brought up colon cancer, and that'll kind of give me the opportunity to just recognize that in March, we actually have Dr. Chablani from the Providence Medical Institute. He's going to be joining us in March for our next show and for Colon Cancer Awareness Month. So I will become exquisitely aware of my colon. And I just got we're getting ready here for a break. So you're with the Providence Holy Cross Health Hour on KHTS, AM 1220, your hometown station. Be right back. And welcome back. This is Tom Burton, Orthopedic Program Manager with Holy Cross Medical Center here on the Providence Holy Cross Health Hour on KHTS, AM 1220, your hometown station. And I have been very, very blessed to have the opportunity to have Vivian Gonzalez and Monica Helm with me here today, kind of going over, screening, I guess, for lack of a better word, of cancer. And we can do it genetically. We can do it through imaging, which is great. And, I think the biggest piece that everyone wants to know is one, are they going to be able to meet you at the expo?
And I will be there. This is Vivian Gonzalez. I will be there providing lung cancer screening information as well as education on tobacco cessation. So I encourage you to come out to the Providence booth, and I'd love to meet you.
And say hi that you heard Vivian on KHTS, which is
That'd
great.
be great.
And Monica, you won't be able to attend, but
There might be a, special guest show up. I might be there, but if I'm not there, there will certainly be information on the program. And I work closely with Vivian, so she'll be able to answer any questions if you have them and I'm not able to be there. But you can definitely pick up brochures on our program, information about myself and my colleagues, as I've alluded to.
oh, fantastic. And now I think probably even more importantly is how does everybody reach you guys? All right, so Vivian.
So again, you can call 1-877-LUNG-INFO, which those numbers are 5864-4637. That is my direct line for the lung cancer screening program, and I can walk you through the criteria and also any questions you may have regarding our program.
Right.
The genetics team can be reached at the general genetics line, which is 818-748-4748, or you can go to our website at www.providence.org/genetics.
/genetics. Perfect. And then, we have the resource number, which I believe they can put you in touch with, so which is fairly easy to remember. It's 888 HEALING, HEALING. The numbers, for those of you who don't want to spell on your phone, 888-432-5464. That's 888-432-5464. And then the main line for the hospital, Holy Cross, very local, on Rinaldi, between the 5 and the 405. Remarkably, it was about a 9-minute drive from the station, from the hospital to the station today. But the main number to the hospital itself is 818-365-8051, and you can go through the hospital operator, and you can reach all of us, Tom Burton, Vivian Gonzalez, Monica Helm. We are available. You can check in with the website at www.providence.org. Look for the Holy Cross. In fact, if you just Google search Holy Cross Providence Holy Cross Medical Center, it'll take you right to our website, and you'll be able to get all the necessary information. And we're coming right up on the hour here on KHTS AM 1220. You're with Providence Health Hour. We look forward to seeing you next month, third Wednesday of the month from 12 to 1. We'll have Dr. Chablani. Take care.